discussion in this section will be focused on intrauterine contraceptive devices, intrauterine systems, and vaginal ring. My name is Dr. Iucd Intrauterine, a senior lecturer in the Department of Obstetrics and Gynecology, Iucd State University and Teaching Hospital. At the end of this section, you should be able to understand the definition of contraception, methods of contraception, intrauterine contraceptive device, the definition, the types, mechanism of action, side effects, insertion removal, contraindication, and we'll talk about intrauterine systems and vaginal ring. What is contraception? For us to understand the subject of contraception, we should first of all know what conception means. And for natural pregnancy to occur, there are three basic requirements. Number one, the man must be able to deliver adequate, viable, and good quality spermatozoa in the vagina of the woman. Number two, the genital tract of the woman must be patent from the cervix to the uterus to the fallopian tube. And number three, the woman must have the capability to release her egg. When these three basic mechanisms are fulfilled, then conception can occur. And when we talk about contraception, that means we want to work against conception. Now we define contraception as a component of family planning, defined as the intentional prevention of pregnancy by interrupting with the chains of events that leads to conception. There is a chain of events that we have established that will lead to conception. Anytime that we work against this chain, then we are doing contraception. And the other terminology to also be clear about is contraceptive. What is contraceptive? Contraceptive is defined as any device or any act whose purpose is to prevent a woman from becoming pregnant. Anything, any device or any act that the main aim of that act or device is to prevent a woman from becoming pregnant, we call that contraceptive. Now, methods of contraception. Traditionally, we have classified contraception into two: the traditional methods and the modern methods. The modern methods of contraception are the methods that have scientific backing. And we can also further classify the modern methods of contraception to the hormonal and the non-hormonal contraception. And we can also equally classify into the long-acting contraception, the short-acting, and the permanent methods of contraception. But for the purpose of this lecture, we are going to focus on intrauterine contraceptive devices, which is a non-hormonal, long-acting reversible contraception. That is LAC, long-acting reversible contraceptive, LAC, L-A-R-C. We also talk about intrauterine system, which is also an hormonal method that is long-acting and reversible contraceptive. And we will talk about vaginal ring. Vaginal ring is a short-acting reversible contraceptive method. Now let us first of all talk about intrauterine contraceptive devices. What is an intrauterine contraceptive device? An intrauterine contraceptive device is a small, long-acting reversible birth control, usually T-shaped, that is inserted into the uterus to prevent conception. The word Iucd is synonymous with IUD. But when we use the term IUD, it is broader because it covers both the non-contraceptive use of this device. For instance, it can be used in the treatment of Asherman syndrome, which in a way it's in a non-contraceptive use. Now, there are types of Iucds, intrauterine contraceptive devices. We have Lippis loop. Lippis loop has a long history and it is almost been abandoned in recent practice. It is an inert double S contraceptive device that can be placed for more than 10 years in the uterus of the woman. It has a property because it contains no chemical and it is inert. The second type of contraceptive device is a non-inert copper-impregnated Iucd, the copper-impregnated Iucd. These copper-impregnated Iucd are available in different shapes and sizes. We have the T-shape that is plain, we have T-shaped banded, and we have the U-shape, and we have frameless copper T Iucd. And the third type is a hormonal-based IUD that is referred to as IUS. That means what we convert an intrauterine device to become an intrauterine system is by impregnating it with an hormonal agent. This is showing us the different types and shape of Lippis loop and copper T contraceptive device. Most of the copper T contraceptive device they are T-shaped. There are some that are in U-shaped, like a multi-load, and then we have frameless. And the copper, we have different number, like for instance the TCU 380. It means that this copper T has a copper of 380 millimeter square surface area. Let us look at an example, the common copper T that we use. The common copper T that we use is the TCU 380A. That is copper T that has a surface area of 380 millimeter square. And the common licensed one, particularly in the United States of America, is the Paraguide. It has a width of 32 millimeters, the length of 36 millimeters, the copper surface area is 380 millimeters, and the duration, it can be used for more than 10 years. The mechanism of action. Now, what happens with the use of copper T contraception is that when the copper T is within the intrauterine cavity, this increases the amount of iron within the intrauterine and tuber fluid, because the copper T is usually placed in the intrauterine cavity, and there will be release of copper ions into the intrauterine cavity, and it will be present in the fluid, in the uterine fluid and the tuber fluid. And the copper T works by causing a general inflammatory response, reducing inflammation, and by also liquefying endometrial mucopolysaccharides. It decreases sperm transport and metabolism. So, in a way, copper T inside the intrauterine cavity acts like a spermicide. So although people have actually argued that copper T can interrupt implantation, however, copper T is not described as abortifacient, but it's a spermicidal, though it can be used as a form of emergency contraception. Copper T, particularly the TCU 380A, is very, very effective. It has a Pearl index of 0.23. That means the effectiveness the failure rate is less than 1%, and it has a cumulative 12 years failure rate of 2.2%. Side effect of intrauterine contraceptive devices. We can have missing Iucd. Missing Iucd is a situation in which the Iucd can no longer be found within the endometrial cavity, and it can result from expulsion. That means there is a spontaneous expulsion of the intrauterine contraceptive device from the intrauterine cavity. It can also migrate into the wall of the uterus and occasionally there could be perforation, and the intrauterine contraceptive device can find its way into the peritoneal cavity of the woman. Infection. We're talking about infection as a side effect of intrauterine contraceptive device. It's usually the infection occurs particularly within few weeks, within 21 days of insertion. And after this period, the rate of infection with contraception may not be different from what is obtainable in the general population. However, for couple or in relationship that the fidelity of the couple is in doubt, then there could be an increase in the rate of infection with the use of contraception. There could be some cramping pain in the woman because the contraception, initially the body may see the copper T as foreign, and there could be some spasm and uterine contraction that can cause some crampiness in the woman. But with time, this disappears. There could also be string problem because some men may complain of actually feeling the string during sexual intercourse. The menorrhagia is also one of the complications of intrauterine contraceptive device, but at times it could be serious, leading to discontinuation of the device, or at times it stops and the woman can continue with her device. Irregular uterine bleeding and spotting have also been reported in intrauterine contraceptive device. The ectopic pregnancy. Usually, intrauterine contraceptive device will prevent both intrauterine pregnancy and ectopic pregnancy. That means when we look at it, the rate of ectopic pregnancy should reduce with the use of intrauterine contraceptive device. However, if a pregnancy should occur due to failure of the contraceptive device, the possibility of an ectopic pregnancy is high. Now let us talk about the insertion of Iucd, because this is very, very important. Iucd insertion is a technical procedure, and family planning providers that will carry out this procedure, they should be well trained. And some people are actually trained in providing long-acting reversible contraceptive. It is an aseptic procedure, and all form of anything that can breach that can introduce infection into the woman should be prevented in inserting intrauterine contraceptive device. The cervix is usually exposed by the use of a speculum, and there are techniques for insertion of Iucd. That's what we call the pull and the push technique for intrauterine device. But for Iucd, the common one that we use, what is recommended is to use the pull technique and not the push technique. Because the push technique in some of these devices can increase the risk of perforation. However, with devices like Lipis loop, which has been used in the past, push technique can be used because the risk of perforation is low. Now, there are different time or the types of Iucd insertion based on the timing of applying the Iucd. And the first type is what we call the interval insertion. Interval insertion is usually done after 6 weeks of delivery or any time the woman desires family planning. That is interval insertion. That's what we call the post-placenta insertion. The post-placenta insertion is when the Iucd is inserted within 3 to 10 minutes following delivery of the placenta. It could follow normal vaginal delivery or cesarean section. But that means we can actually insert our Iucd immediately after the delivery of the baby, particularly if we know or if we're in an environment where it may be difficult to bring the woman back for contraceptive method. So this one it has been done successfully and it is safe. Then we can also have what we call the post-abortal insertion of Iucd. Immediately after a termination of pregnancy, either induced abortion or a spontaneous abortion, then we can immediately, after the evacuation, insert a contraceptive device. And again, it's also been found to be safe and in this category. And more so, IUCD has also been found to even be safe in every category of women, although there are some definite contraindication. But it can be used in adolescents, and it can be used in women of reproductive age group. Now, removal of IUCD. The removal of IUCD is usually very easy. However, aseptic procedure must be followed, and there should be gentle pull on the string to prevent the string from removing from the IUCD. There are contraindications to the use of IUCD. And number one is pregnancy. We should make sure that the woman is not pregnant while we want to provide IUCD. And even if there is failure of intrauterine contraceptive device, then the IUCD should be removed immediately. If there is any significant distortion in anatomy of the uterus, either congenitally or acquired distortion, it's a contraindication to the use of IUCD. Unexplained vaginal bleeding, particularly if pregnancy is in doubt or we are not sure of pelvic malignancy, like cervical cancer, is an indication to withhold contraceptive device. Gestational trophoblastic disease with persistently elevated beta human gonadotrophic homochronic gonadotrophin levels is an indication. It's a contraindication to the use of IUCD. And if there is an active infection, ongoing infection, is a contraindication to the use. Under this condition, the infection should be first of all be treated before IUCD can be used. Now, we talk about intrauterine system. Like I said before, IUD, unqualified, may be referring to intrauterine contraceptive device. However, IUD means that we can also still use it for other indications apart from contraception. In intrauterine system, it's also an intrauterine device. However, this device has been impregnated with hormone. And anytime we have IUD impregnated with hormone, we refer to that as intrauterine system. And intrauterine system is also a small, flexible plastic, T-shaped, just like intrauterine contraceptive device, that releases continuous low-dose progestogen to prevent pregnancy. It's usually effective for 3 to 5 years, depending on the brand. And when properly used, most of the intrauterine system, they are also very, very effective with a failure rate of slightly higher than 1% or 1%. And there are different forms of intrauterine system that is available. We have the Progestesat, we have the Mirena, the Kelina, Lelita, and Skylar. But I'm just going to quickly take us through the discussion on the Progestesat and Mirena. Now, Progestesat, it is usually T-shaped and has about 36 millimeter tubular vertical stem. It contains 38 milligrams of microcrystallized progesterone. It is impregnated with barium sulfate to make it radio-opaque. And the horizontal arm is 32 millimeters. And it releases progesterone continuously into the uterus at an average rate of 65 micrograms per day. Progestesat, apart from providing contraception, is also used in the management of menorrhagia, particularly due to endometrial hyperplasia, or in the management of secondary amenorrhea. Mirena is also T-shaped, but this time around, the progestogen in Mirena is a levonorgestrel, and it contains about 55 milligrams of levonorgestrel. And this one is released at the initial stage at the rate of 20 micrograms per day. The T-body of the Mirena is 32 millimeters, in both horizontal and vertical directions. And it is also compounded with barium sulfate, which makes it opaque. The picture of Mirena is displayed. Now, let us look at the mechanism of action of the intrauterine system together. Because they are hormonal based, mainly they are progestogen-based hormone. Then, because of the progesterone content, they cause thickening of the cervical mucus. And this one will prevent the sperm from actually penetrating through the cervix. And they also make the inside of the uterus very fertile to sperm. That means you have some level of spermicide. There is also called the thinning of the endometrium, and that is why they are valuable in the management of menorrhagia from endometrial hyperplasia. And it is very suitable when we have menorrhagia, and in women who desire family planning. When we have the both combination, then it is better to go for intrauterine system. Now, vaginal ring. Vaginal ring is also one of the advances in contraception. They are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over an extended period of time. The ring is inserted into the vagina and provides contraceptive protection. Vaginal rings come in sizes that will fit into the vagina of most women. There are different types of the vaginal ring. We have the common ones are the Nova ring. We have the Proge ring. The Proge ring containing progesterone as a sole ingredient. It is available in Chile and in Peru. The Anovera is also a contraceptive ring that is manufactured from methyl siloxane-based polymers, and it releases progestin and estrogen. Now I'm going to concentrate my description of the contraceptive ring around a particular one, the Nova ring. The Nova ring. The Nova ring is a commonly used type of vaginal ring. It is small, it is transparent, it is colorless. It is non-biodegradable, and it is usually inserted in the vagina. The ring contains combined contraceptive. It contains two active components. The progestin inside the Nova ring is the etonogestrel, 11.7 milligram of etonogestrel and 2.7 milligram of ethylene estradiol. When it is placed inside the vagina at the initial stage, it releases an average of 120 microgram of etonogestrel per day and 15 microgram per day of ethylene estradiol over a 3-week period. And this is the advantage because it contains low-dose progestogen and estrogen. The low-dose estrogen is an advantage of the Nova ring. The outer diameter is 54 millimeters and it has a cross-sectional diameter of 4 millimeters. Example of Nova ring: it is colorless, it is transparent, and it is very easy to insert inside the vagina. And usually it is left in the vagina for 3 weeks. 3 weeks. After 3 weeks, it is removed for 1 week so that the woman can menstruate. As long as the Nova ring is inside, it will work like a combined oral contraceptive pill. And it is removed for 1 week, just like we have the placebo in the oral contraceptive pill, so that the woman can menstruate. And the woman will replace with another one. Now, the mechanism of action of vaginal ring is just like the combined oral contraceptive. Usually, primarily, it works by preventing ovulation. It manipulates the hormone, suppresses the gonadotrophin, and there is a suppression of ovulation. However, there is a secondary mechanism which is inhibition of sperm penetration because it also causes thickening of the cervical mucus. Apart from the contraceptive use, combined vaginal ring like the Nova ring is also useful in the management of endometrial hyperplasia and secondary amenorrhea. There are definite benefits of the vaginal ring. Number one is that it is user dependent. It is not provider dependent. So the woman can self-administer the ring. It is easy to apply and it is easy to remove. And it also makes sure that we protect the privacy of that patient. It also has a very low content of estrogen than when we compare it to other combined oral contraceptive pills. So the incidence of nausea and breast tenderness and other complications of high dose estrogen is not present in Nova ring. And there is also low incidence of irregular vaginal bleeding despite its low estrogen dose. I want to conclude this session by saying that there's a lot of recent advances in the areas of intrauterine contraceptive device, intrauterine system, and hormonal vaginal ring. This innovation are to make contraceptive method more acceptable, more users-friendly, and less providers-dependent. The family planning providers, particularly in the developing country, should keep abreast of the latest information to improve on the current low contraceptive prevalence. Thank you.